Local, county, and federal officials gathered at Christ Hospital in Jersey City on Tuesday afternoon to discuss a new tiered insurance plan introduced by Horizon Blue Cross Blue Shield that they believe would have a negative impact on residents throughout the county.
The tiered insurance proposal, referred to as OMNIA Health Alliance by Horizon, the largest New Jersey insurance provider, would offer discounted health care for 34 hospitals, and 22 of those hospitals will receive higher reimbursements from Horizon, according to a report by NJ Advanced Media from September 12th. However, Hudson County officials are not thrilled with the plan, since CarePoint Health, Christ Hospital in Jersey City, and Bayonne Medical Center, as well as Palisades Medical Center in North Bergen, are not currently a part of the OMNIA Tier 1 plan that boasts savings on premiums, deductibles, and copays. Jersey City Mayor Stephen Fulop said OMNIA could impact 60% of the hospital beds in Hudson County, which could be catastrophic for healthcare delivery in this entire region.
By far the largest insurer in the state of New Jersey, and their proposed OMNIA plan. Many of us read about it for the first time in a newspaper, and that could have an impact of 60% of the beds here in Hudson County. Needless to say, an impact of 60% could be catastrophic on healthcare delivery throughout this entire region for certain. The proposed plan is an agreement between 30 hospitals, approximately, where those hospitals would receive preferential or beneficial rates. And essentially it allows Horizon to be the one choosing who's successful and who fails within the healthcare community. The impact between somebody visiting a Tier 1 hospital and not a Tier 1 hospital would be a $3,000 difference.
Assembly Speaker Vincent Prieto stated that urban areas appear to be getting shortchanged by OMNIA, adding that the scenario would have a serious impact on public employees.
Safety net hospital, CareCube facilities, we can't afford them to fail. And when you talk about urban areas, that area is, people are less mobile and you can't get to places. When you only have one hospital in Hudson County that would be in this network, that's a problem. And how do these people get there? And when you look and you have to go to a Tier 2 hospital, then the costs are unbearable. So we're trying to see how we can make this work at the state level to get affordable health care delivered to our residents, but at what cost? There are a lot of public employees. Horizon is pretty much the insurer for a lot of local county employees, and now how are these people going to be able to choose?
State Senator Nick Sacco, also the North Bergen mayor, explained how leaving Palisades Medical Center out of the mix would negatively impact North Hudson and South Bergen counties.
Palisades Medical services the towns in North Hudson and South Bergen. Every public employee has a Horizon policy. All municipal employees would be banned, or would ban themselves from going to Palisades Medical Center because of the tier that they would be in and the amount of money it would cost to go there. So our local hospital, which is right down the road, could potentially cease to exist insofar as public employees are concerned. Now, I don't know how this is considered justice, or how the health benefits plan Horizon can make a decision that disenfranchises the entire municipal employee population and all.
Bayonne Mayor Jimmy Davis expresses displeasure with residents of his city being potentially left out in the cold by OMNIA.
I come from a city of 65,000 people who depend on one hospital. This should not be about dollars and cents. This should be more about common sense. And to alienate people and alienate cities is not what healthcare should be about.
U.S. Rep. Albio Sires exclaimed that OMNIA would defeat the purpose of having affordable health care.
For all those people that we fought, this two-tier effort is going to cost them $3,000 more. Not to mention the fact that the transportation to get these hospitals, people need a local hospital where they can walk to or take a cab to. You're going to go to Hackensack to save $1,500?
State Senator Sandra Cunningham, Hudson County Executive Tom DeGees, and Hoboken Freeholder Anthony Romano also took the podium during the event. During a question and answer session with the media, Prieto clarified that the measure would be administrative as opposed to legislative, although both the Assembly and the Senate will be having hearings on the subject. Cuttingham said the first Senate hearing on the topic will be October 5th, which is necessary since registration for OMNIA will begin in November before the new program will potentially take effect in January.
I'm Heinis from the Hudson County View, the eye of the community.